Hi there. Thank you for joining me on the program Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. Remember, if you have any questions, you may send them to WhatsApp by 620-6275 or send an email to docandcovid@gmail.com. Today we continue our conversations with behavioral scientist Dr. Devendranand Sharma, who has extensive experience in the field of mental health, behavioral health, and he has graciously agreed to share his expertise with us today so that we can continue our conversations, understand more about this condition as it relates to the COVID-19 pandemic. Thank you again, Dr. Sharma, for being here with us. So we're going to go right into asking some very basic questions that would help us all understand this whole concept of mental health well-being during the COVID-19 pandemic. If persons themselves believe that they are at risk or they know someone at risk, at what stage do you think they should actually seek formal professional help?
I think the earlier you seek help, it would be better, to be able to start or open up about what they're feeling to somebody who is able to connect them to support service or directly reach out to a professional. Many of our doctors are trained in recognizing and managing emotional disorders, so I think they can reach out through their family doctor. But if we're dealing with a young person who's troubled by thoughts of feeling what's the purpose of life, or when is it going to normalize? I talked about this very sad case in Baltimore of a young man who ended his life. And it's truly a tragedy if any of our young people would end their life, because there's so much we need from our young people. There's a future for them. So I think getting to someone who can hear them out, or if that person is not giving them a supportive ear, don't give up. There's many support services. There's a new helpline out there. I'm sure, Doc, you will be able to share that number that they can reach out, and there's support through that new line that is within the Ministry of Health support services. So avenues of support. So the earlier people get to see somebody, the earlier they're treated. The good news is that with early treatment, recovery is very much possible. We can get more than a 95% recovery rate. That's probably about the success rate of the vaccine. So,
Yes.
it's a pretty high number, and even those people who may not recover through one doctor, there's always choices. So, don't allow yourself to feel bad, or to think negatively, or to behave in a bad way, or to turn to drugs or substances. There is support that can make that
Professional
change.
support.
Professional support.
Yeah, so a lot of persons have delayed or denied themselves the appropriate care that they need, going to hospital for symptoms not related to mental health. But given the enormous stigma that has been associated with mental health before COVID, and now we have COVID-associated mental health or behavioral disorders, how do you see us minimizing and reducing or even eliminating the stigma associated with mental health in this era?
Very good question. It's got to be through a multi-agency approach. So it's not just one person, though. If everybody takes it as a responsibility, I'm very proud of my colleagues in the medical profession that they see problems of brain health as significant. Many of them would catch people early. If we have physicians who are not able to pick up these problems and refer, it's going to be problematic for people. But they do that, and I keep giving them credit for that. So we got a lot of good people in the health sector, trained very well. They need to have sources of referral. They need to have the people who can provide the care that the persons will benefit from. And we need to overcome the stigma, like by all of us taking that responsibility to make people understand that emotional and behavioral and thought disorders are all things that we ourselves suffer from. That those of us who feel that we cannot have a mental health problem, we don't understand that it's coming from the brain, that the brain itself, if it goes ill, may not even know that it's ill. So it's got to be persons outside who would recognize that. Many people, unfortunately, who suffer with more severe psychotic type illnesses where there's a break from reality, don't understand that they're ill, they refuse to be in treatment. Sometimes when it gets too bad, they behave so abnormal that they look like figures of fun, for making fun. And it's truly unfortunate if people make fun of these individuals because they've gone out of control. It's like I tell people, if somebody has a brain tumor, it can affect their behavior in such a way that they behave very abnormally. And we wouldn't make fun of them if we knew what was behind that behavioral problem. Even people with addiction disorders who behave abnormal, the problem is the addiction, and we need to fix that problem, not belittle the individual and call them names and say they're weak-minded. Sometimes even very, very advanced persons in society, very good professional people, can suffer severe addiction. I had one of the top lawyers in Jamaica who actually had a severe cocaine addiction, and was a man who had owned nearly six different fantastic vehicles and became a person who was almost in the gutter. So we pulled him out of that situation, and he's back into a very good practice. So anybody can be affected by these conditions. The brain is very vulnerable. Once it's protected by a hard skull, inside of it, it's pretty vulnerable. And there are many factors that can make it go bad, including the way our genes operate against us. So making people recognize that brain disorders are a disorder like any organ system of the body, that the most important organ system is our brain, that we need it to function well, to think well, to feel well, and behave well, that it's nothing to feel embarrassed if any one of those functions go bad. They can be fixed, like how you would fix the heart if it goes into fibrillation or arrhythmia. The same way if the brain starts to fibrillate, a person can have a seizure. The neurochemicals go down, they can get depressed. If it goes too high, they get too high. So the brain flows with the changes in the various components of itself. So can be treated, can be fixed. The majority of brain health issues are fixable. Even the very severe psychotic patients, they can be treated. The majority of them improve. There's always going to be some who require long-term treatment, and those we put into institutional care, though we're talking more now in the future of having more something like community health care, community homes. The UK has moved to that model of care rather than the big institutions. And
right.
So those are a better way of managing those type of disorders.
And that can help reduce the stigma as well.
Oh, absolutely.
People being in homes rather than institutions.
Rather than being institutionalized.
So I think one of the more important things that you just said is that it can affect anyone. It doesn't matter how important or how educated you are. It can affect anyone.
Absolutely.
Thank you for sharing that insight. And I take it that children are just as easily affected as adults?
Yeah, children are a particularly vulnerable group because, they're developing, their personality is developing, they're going through phases of development that in each phase they need to be managed very carefully. That, for example, in the early stages of life, they're very dependent on the parents. As they grow older, they're starting to exhibit more autonomy and they want to become young adults in their way of behavior, but they're still dependent. So we as parents have to provide that support for them. And you rightly said, their brains are still developing, Very early, they're still, even when they're born, their learning capacity is growing exponentially. It's a fantastic change of the brain. It's amazing to see that change in the early years of life. And that goes on throughout their teenage life, when we believe at about 18, their personality starts to get fixed.
Yeah.
So they're more of what we will see them for the future.
So since this pandemic has started, children have been home, not going to school, at least in Guyana. Do you see significant consequences of keeping kids home long term rather than in school, in that social environment, or being confined to home? What do you anticipate will happen?
It's unfortunate, and I think if we look at evidence and evidence-based driven medicine, that's what we practice. We practice medicine that's driven by data and facts, not by just emotions. We got to understand our children, while a vulnerable group, they're not as vulnerable as the elderly and people with pre-existing health conditions. The numbers of children who suffered fatality from COVID is low. And if schools are practicing good safety practices, the chances of our children dying are going to be low. I understand the emotions that would occur and the fear sometimes in our persons of authority who may feel, I don't want to take a chance with even one child. But we have to think about the benefits versus the disadvantages. And the disadvantages of having children change to this isolated type of learning, away from the contact with each other, is not good. And many children are experiencing significant depressions as a result. And as I said, they're turned into methods that are not healthy. Often parents may not be in the home and they leave the children with older parents or the children grandparents, or sometimes caregivers who don't have that interest, and they're not watching what the children are doing. So there's a significant exposure to social media for children now through cell phone activity, unsupervised cell phone activity. A lot of children turn into games, trying to beat the educational system, not seeing the value of it, and it's not healthy. So we need our children to be back into social groups, to be able to learn in that type of atmosphere, which is more human type of interaction than
as a country,
artificial media.
As a country, what do you think we should do in Guyana to address behavioral health or mental health in the COVID era?
I think what we're doing so far is good. There is a lot of work that many persons are doing. You're leaving your work to come out and do a public education program. Many of our doctor groups are working well. Dr. Anthony, even before he became minister, set up a COVID support group of many doctors who are sharing, and we're connected to doctors from the US and Canada, and it's extremely good. So there's much that's being done. What more can we do? There's always more. So I think getting facts out there, constantly educating against misinformation, working towards helping our people develop good healthy activities, which includes, as we mentioned before, good exercise, good nutrition, good immune building capacities, build our immune systems well, is good. Recognizing emotional disorders and behavioral disorders, seeking early help, knowing where the help is, making that helpline available is an awesome thing. So commend those people and the telephone company that's involved in that. So great work by you. Our social services are doing their best. There's a lot of companies that have provided masks, and people were doing that even during difficult times of the election crisis. We had people going out there in the community and sharing those protective masks and protecting our people. Keep educating our people to the need for self-protection, but also keep working towards building knowledge that, look, if you have emotional problems, you have behavioral problems, it's nothing to feel embarrassed about. There is support, there is help. Just reach out and find the avenue of support and get it.
Good. So one last thing before we go. as it relates to healthcare workers, the doctors, the nurses, those who are constantly in contact with COVID-19 patients, especially the very sick ICU patients who sometimes don't do well. Do you think that those professionals, those healthcare workers should have mandatory behavioral health support as part of getting care for the caregivers?
Yes, I think that's one extremely good suggestion. Support that they can turn to, that they can use, that they can even be a support center. I talked about this in a CME I presented just recently to our doctors, where you would want a support system in every place, or some, now if you can make it in every institution or workplace, that they have an access to a support system, a support center, which would have people who are counselors, who are social support workers, who are able to give that advice and guidance and support, manage their grief. If we lose, as a healthcare worker, we want to lose nobody. And we're constantly losing people, so there's a lot of grief that healthcare workers experience. There's a lot of fear of being infected themselves by people who are careless. So they need that support. You're absolutely right, Doc. But apart from that, I think also we need to give them support that recognize when they're burnt out. We must pick it up easily and not make them feel bad that if they need some time off that they can get it. Incentives for the work, I hear the government talking about that. Great for you, because, you know, and don't let people say that this is a bad thing for healthcare workers. We know they do need that incentive. Again, the phone companies have been given that kind of encouragement and support by cutting down the cost of that. So anything that you can make the life easier for our healthcare workers. I talked about even reducing shift time, but again, we got to balance the numbers of people. I don't want to be in a problem with anybody, but we got to be careful that they don't get burnt out, they don't become disillusioned, they don't leave that very valuable job. So giving them credit, giving them a special Christmas bonus, Mr. President.
Right. Well, thank you very much, Dr. Sharma. We've been talking to Dr. Devendran Sharma on the program Your Doctor and COVID, behavioral scientist and professor of behavioral science. I'm Dr. Mahendra Carpen, the head of medical services at the Georgetown Public Hospital. I want to thank you very much for watching and listening to this program. Remember, if you have questions, feel free to send a WhatsApp message to 620-6275 or send us an email to docandcovid@gmail.com. Thank you once again for being a part of this program.